gonna gather and cleanse my equipment here. I got my gloves, hand sanitizer, medicine cups, pill crusher, and my markers. If I need to do split, everything's all cleansed. All right, we're ready to go. Hi, my name's Terry Dilly. I'm going to be your student nurse with you today. I'm going to perform hand hygiene. No PPE is needed at this time, but I will put gloves on when I give the medications. Hi, could you tell me your name and your date of birth?
Joseph Smith, 10-5 of 54.
Okay, checking your ID. Could you tell me, do you have any allergies?
Nope.
All right, and are you in a comfortable position?
Yeah.
All right, at this time, I'm going to just do a little assess. I'm going to check your gums for bleeding. Okay, none noted. Check her atypical pulse. It is 56. I'm going to check her for edema. No edema noted. And do you have any pain today?
No, not today.
Okay, and could you, oops, I forgot. I'm going to go ahead and provide for privacy. Could you tell me how you'd like to take your medications?
Yeah, just a pill with some water is fine.
Okay, alrighty. I'm gonna go ahead and check my provider orders, and when I check them over, I'll be looking to see what medications I will be giving to you today. Is that okay?
Yep, sounds good.
Okay, so at this time, I'd make sure that the bed is down and locked, side rails are up, call lights in reach, no trip hazards. And is there anything I can give you while I'm here?
Nope.
All right.
Thank
At
you.
this time, I perform my hand hygiene as I leave. And the bedside table's there for her. Okay, at this time, I'm gonna go ahead and check my orders. So at this time, I have Joseph Smith, 10-5-54. I have digoxin, 0.125 milligrams by mouth daily for CHF AFib. This order is active. Joseph Smith, date of birth 10-5 of 54. I have digoxin, 0.125 milligrams by mouth daily for CHF and AFib. This has not been given. I have Joseph Smith, 10-5-1954. I have Lasix, 40 milligrams by mouth, NG tube or PEG tube, BID for CHF. This order is active. I have Joseph Smith, date of birth 10-5-54. I have Lasix, 40 milligrams by mouth, NG tube or PEG tube, BID for CHF. This med has not been given. I have Joseph Smith, date of birth 10-5-54. I have warfarin, 5 milligrams by mouth, NG tube or PEG tube daily for AFib. This order is active. I have Joseph Smith, 10-5-54, warfarin, 5 milligrams by mouth, NG tube or PEG tube daily for AFib. This has not been given. Next, I have Joseph Smith, date of birth 10-5 of 54. I have oxycodone, 5 milligrams, 325 milligrams, 1 tablet by mouth every 4 hours of a pain reading of 1 to 4. This is active. Joseph Smith, date of birth 10-5 of 54. I have oxycodone, 5 milligrams, 325, 1 tablet by mouth, NG tube, PEG tube every 4 hours for a pain rating of 1 to 4, but it has not been given. I have Joseph Smith, date of birth 10-5 of 54. I have oxycodone, 5 milligrams, 325, 2 tablets by mouth every 4 hours, pain rating of 5 to 10. This order is active. I have Joseph Smith, date of birth 10-5 of 54, oxycodone, 5 milligrams, 2 tablets by mouth, NG tube, PEG tube every 4 hours for a pain reading of 5 to 10, and it has not been given. All right, I'm gonna go ahead and put my provider orders on the bottom. Okay, I have digoxin. The lab value is 0.8 to 2. The digoxin level is high, it's at 2.2, so I will not be giving this medication. Considerations, don't use this for AFib. Second or third degree heart block or a pulse under 60. Our pulse was under 60 today. Lasix, the normal lab value is 3.5 to 5. Our lab value is 3.2. Our sodium was 130, so it was low. Normal range is 130 to 145. Considerations is heart failure, hypertension, hypokalemic, serious rash, Stevens-Johnson's. Okay, the next medication is warfarin, Coumadin. Our INR level 2.0 to 3.0. We were at a good level, therapeutic at 2.2. So we will be giving this medication. Considerations to monitor platelets, INR, blood in the stool. And yeah, we'll give it because we want to keep it at a therapeutic level. Oxycodone, we will not be given. We had no pain rated today. Considerations would be constipation, addiction, withdrawal symptoms if you stop suddenly could cause drug dependency. So at this time, I'm going to go ahead and mark. We are not giving the digoxin, so I'm going to label it 3-3 student nurse. And it is 11:10, and I'm going to go ahead and circle that. We are not giving the Lasix, so I'm going to go ahead, 3-3 TD student nurse, 11:10, go ahead and circle that. And then we're not giving our oxycodone because there is no pain, so I'm going to go ahead and mark for both of those, and I'm circling it. Okay. So at this time, I'm going to do my first medication check. I'm going to go ahead, pull out the medication. So at this time, we have Coumadin, or Joseph Smith, date of birth 10/5/54. We have Coumadin, 5 milligrams by mouth, NG tube or PEG tube daily for AFib. So on our medication here, I have warfarin, Coumadin, 5 milligrams, expiration date 11/6/2036. Package is intact. I will go ahead and put that in my med cup. I will go ahead and get ready. I will take a breather. Okay, so we have Joseph Smith, 10/5/54. We have warfarin, Coumadin, 5 milligrams by mouth, NG or PEG tube daily for AFib. Go ahead and look at my medication. It says Coumadin, warfarin, 5 milligrams, expiration date 11/6/2036. Package is intact. I will go ahead and put that in my med cart. That was my second med check, so I'm going to go ahead at this time, go into my patient's room. Hi, my name is Terry Dilley. I'm going to be your student nurse, perform hand hygiene. Could you tell me your name and your date of birth?
Joseph Smith, 10/5/54.
I'm going to go ahead, check that. Any allergies?
No.
Okay, and are you in any pain at this time?
No, not today.
Okay, you're still doing good.
Mm-hmm.
Okay, at this time when I went through and checked your labs, it looks like today we're going to go ahead and do Coumadin for you. Your lab level was 2.2, so we're at a good range. So we're going to want to keep that at a therapeutic level.
Okay.
It helps with blood clots, so it keeps used as a blood thinner. And could you repeat that back to me, what the Coumadin is used for?
Yeah, it keeps my blood thin so it doesn't clot.
All right. And the side effects that could happen, common ones are nausea, cramps, fever, and rash.
Okay.
Could you repeat that back to me?
Rash, nausea, cramps.
All right. So if you have any of those, go ahead and push your call line, okay?
Okay.
If you had any of those side effects, I would go ahead and I would stop your medication right away. I would go ahead and do a set of vitals on you. I would notify the pharmacy and your provider.
Okay.
Do you have any questions or concerns about this medication before I give it to you?
No.
All right. So I will go ahead, do my hand hygiene. go ahead and put my gloves on. So at this time, I will do my third med check. So we have warfarin, Coumadin, 5 milligrams by mouth, NG tube or PEG tube daily for AFib, and it has not been given for this time frame. I'll take that medication out. Coumadin, 5 milligrams, expiration date 11/6/2036. Medication is intact. I will go ahead and put that in there. Okay, and she said that she would take her medication with a cup of water. All right.
Thank you.
All right, and then if there was any side effects to this, or I will be coming back in 15 to 30 minutes just to do a check and make sure everything's going okay for you.
Okay.
Is there anything that I could get for you while I have time?
No.
All right, and are you comfortable?
Oh, yeah.
All right, and I would do my hand hygiene. Okay, and the 5 steps for the room is bed in low position, bed lock, side rail, call light and reach, and the side table and patient surroundings are clear. All right, thank you.
Thank you.
So I would go back, clean our hand hygiene before I left the room, and I would cleanse my equipment. And I am going to go ahead and date and time that I gave the Coumadin, 3/3, Terry Dilly, student nurse, 11/15, and I will not circle that. If I had any findings, I would go ahead and notify the provider, pharmacy, and document anything per patient or for facility policy, and I will upload everything in my OneNote and Schoology. Thank you.